Okay, let's talk about imperidine. Also known as Demerol. Okay, so I misspelled that. That is an E, not an O. First things first, Demerol is a narcotic. Opioid. Demerol is a very good, very powerful medication that does well for what it's used for. Of course, being a narcotic, what is it used for? Analgesia. By binding through binding with opiate receptors. Okay, so you're going to notice that Demerol is a little bit more, little less specific than the rest of them. Okay, because Demerol is not widely used. It is not widely used in fact, I don't think it's used at all in the pre-hospital setting. It is not used in local hospital setting or ER setting, correction. It is, however, used in the surgery where it's very controlled. That being is the reactions to Demerol are quite often. A lot of people have adverse reactions coming out with the Demerol as pain control, coming out from under anesthesia or whatever, from whatever procedure they do. It does, as we get into the adverse reactions. Indications, again, moderate to severe pain. Our contraindications: allergy to the drug or hypersensitivity, patients that are taking MAOIs or monoamine oxidase inhibitors. Don't want to give it to those. Our dosing is 25 to 100 milligrams, and that is given IV, IO, IM, sub-Q, and PO. I don't know why we're talking about giving it sub-Q when IM is the preferred route if you're not going to give it IV or IO. Adverse side effects. We'll start with nausea, vomiting, euphoria, respiratory depression, again leading to apnea if given too much, and dysphoria. So as much as it can be super good, it can be super bad. Drug interactions, again, we already talked about that with the MAOIs. Do not give if somebody is taking an MAOI. Use appropriate monitors. Anytime you have a patient on a narcotic or a sedative or an anesthetic type of drug, you want full monitors. You want cardiac, you want SpO2, end tidal if possible through nasal cannula, or if they're, of course, if they're intubated, you're going to put it on your tube anyway, or underneath the mask with the nasal cannula. You want as much monitoring and blood pressure. You want as much monitoring on them as you can while you have them. That way you can trend a adverse effect when it's starting and when you need to intervene through supportive care or through reversal if necessary.